My name is David Gamer. I'm the National Director of the Center for Emerging Infectious Disease Policy and Research, also known as CEID. I'm temporarily replacing Naheed Bedelia, who's off on sabbatical. Thank you very much for joining us for this important conversation on public health communication. We're honored to be joined by distinguished EU alumni under the United Nations Under Secretary General for Global Communications, Melissa Fleming. Just a little bit of background on CEID. CEID's mission is to improve social, societal resilience against the threat of emerging infectious diseases worldwide through research, capacity strengthening, training, and advocacy. And we've centered our work on 4 pillars: governance, resilience, innovation, and trust. We refer to it as GRIT. We're CEID and GRIT. All you need to know. Today's discussion focuses on our core pillar of trust. So building trust between scientists, governments, public health organizations, and affected communities. The cornerstone is responsible for preparedness and response. Our research at CEID focuses on identifying evidence-based strategies for dispelling misinformation and combating disinformation, which have really been a major problem during the COVID pandemic that they have been before. We also work on addressing vaccine hesitancy, cyber information exchange networks, and sort of exploring the role of geopolitics in the use of disinformation, identifying best practices for communication of scientific uncertainty, and reimagining media and public health interactions during outbreaks. At CEID, we also believe that our efforts to combat pandemics must be multidisciplinary. So we've had faculty members from many different parts of Boston University, but also outside of Boston University with a range of different types of expertise. In that spirit, I'd like to give a special acknowledgement to today's moderator, Dr. Tracy Hong. Dr. Hong is core faculty at CEID, an associate professor of media, science at the New College of Communication. In her capacity as CEID faculty, she also serves as a member of our science communications working group. And this group has been awarded a pilot grant along with Dr. Veronica Wirtz and Gary Vijaya to analyze social media misinformation and vaccine hesitancy in 3 middle-income countries. So I look forward to the conversation that she's going to help lead. Furthermore, we're really excited that this is really a multi-player event in more than one way. We have co-sponsors from across the EU community. I'd like to thank the Alumni Association, the College of Communication, the Frederick S. Pardee School of Global Studies, the Global Policy Development Center, and then the Rafiq E. Hariri Institute for Computing and Computational Science and Engineering, which needs a shorter name. So many of our co-sponsors represented here today. I'd like to particularly acknowledge Kevin Gallagher, who's the director of the Global Development Policy Center and CEID core faculty, Yanis Pascalidis, who's the director of the Hariri Institute, and Scott Taylor, dean for the Pardee School of Global Studies. And finally, last but not least, Mariette Christina, dean of the College of Communications. So I'm going to say a few words.
Thank you, Dr. Hamer. It's lovely to see you all here today in person. And I know that I am between you and a wonderful conversation and talk, so I will be as brief as I can. At the College of Communication, we like to say that our role is in building understanding for the world to help us grapple with the societal challenges, some of which we were just talking about. In fact, Dr. Hamer just reminded me that at the beginning of the pandemic, the WHO declared it an infodemic. There was so much misinformation and disinformation about. It is a true honor, really, to be able to introduce to you somebody who has lived up that, lived so high to that potential in an inspiring way, this ability to improve the world through better communication. And I'm delighted to introduce you to Melissa Fleming, who's been the UN Undersecretary General for Global Communications since September 2019. And in this role, she leads the organization's global communication efforts. From 2009 until August 2019, Ms. Fleming served the UN High Commission for Refugees as head of global communications and spokesperson for the High Commissioner. At this UN High Commission, she led global media outreach campaigns, social media engagement, and including a news service to distribute and place stories designed to generate empathy and stir action for refugees. Ms. Fleming is a frequent interview guest on international media platforms, and her talks are featured on TED.com. She's the author of a book, A Hope More Powerful Than the Seed, and the host of an amazing award-winning podcast, Awakening, which I hope you'll get a chance to listen to. It's pretty amazing. Ms. Fleming joined the UN High Commission for Refugees from the International Atomic Energy Agency, where she served for 8 years as spokesperson and head of media and outreach. Prior to the agency, she headed the press and public information team at the Organization for Security and Cooperation in Europe. And earlier still, she was public affairs specialist at Radio Free Europe, Radio Liberty in Munich, having started her career as a journalist. From 2016 to 2017, she also served as senior advisor and spokesperson on the incoming United Nations Secretary General's transition team. Ms. Fleming holds a Master of Science in Journalism from the College of Communication, where I'm also a proud alma mater, by the way, here at Boston University, and a Bachelor of Arts in German Studies from Oberlin College. It's my true pleasure and honor to introduce to you Ms. Fleming.
So much, and that I think that was a bit. Sometimes think back and wonder how I was going to go through all of that, but it's been an interesting career so far since I left the wonderful College of Communication at Boston University, and how amazing it is to be back and to be able to speak to you, and also to see how we are working together to solve our world's problems in such a cross-disciplinary manner. We're also taking that approach at the United Nations, and the one that I'm responsible for is trying to communicate the state of the world to the world, but in what I'm going to be talking to you about, unfortunately, a very toxic and polluted information ecosystem. It's much different than when I was doing my master's degree. Then the challenges have just grown, because lies really are poisoning our societies from our perspective. Mis and disinformation and hate speech that is spreading online, in our view, is causing real harm to our world. We as the United Nations, who are all over the world in our offices, we're really seeing this globally. And we're most concerned right now, in any case, with the impacts of 3 areas, which we're calling the 3 C's, and that's COVID. And we're still living with COVID. I'm glad to see that you all recognize that here: climate and conflict. And so, again, as I said, my job at the UN is to lead communications as a public good. And the UN is really behind a lot of the science, for example, around climate change. We're around the statistics of human suffering, the numbers of refugees in the world, and the state of conflict and wars. And yet, we are faced with such a challenging environment. And so, as a tool to build trust and to deliver the information people need, we have to just get so much more strategic, so much better, because trust is really being eroded. And it is seriously, and we're focusing here on one of the, first and foremost on the big C, COVID, and the pandemic that we are still in, but we've lived through over the past 2.5 years. And what we kind of learned from that as people who are trying to communicate the science, trying to guide the public, and struggled. So a little bit of an analysis. False and misleading content is damaging our information ecosystem in 3 ways. I mean, first, as I mentioned, it really does undermine trust in scientific facts. Science, as you know, for those of you who are scientists, it is also, and particularly in a global pandemic, with a novel virus, it is nuanced, it is changing, it is not black and white, and it is challenging to tell stories about. Others who don't have much respect for the truth and don't mind, can create very, black and white and simple solutions where scientists can't. So it's challenging. And when you're up against that, unfortunately, trust did erode and has. It warps public debate as well, robbing it of fact-based and science-based arguments. And it makes it really, and I mentioned the infodemic that WHO declared shortly after it declared COVID-19 a global pandemic. Infodemic really means looking at people out there navigating and trying to find good information and being faced with just this onslaught of information sources, some trusted, some factual, and many not. So obviously during a pandemic, everybody needs reliable advice to remain safe. But we're also in a situation where demand is not only just hugely heightened, but there's also a very heightened state of fear. And the good actors, like I would say the United Nations and public health institutions, doctors and scientists are, really did struggle and do struggle to keep pace and also to compete with the kind of storytelling that some of the disinformation actors use so effectively. So we saw actually that disinformation actors became real masters of the algorithms. And these are algorithms, for those of you who I know that I'm sure you're all on social media, who know that the algorithms reward engagement heavily. They don't generally reward the engagement of, kind of just kind of facts and science, but rather misogyny, outrage, and very often junk science. So basically, we saw this epidemic as soon as COVID-19 hit. We saw WHO over Geneva struggling. We in New York decided that we needed to join forces and to make this our cause. We were working on promoting the Sustainable Development Goals and climate action and peace, and we had to really switch course and really compete against the conspiracy theories that we heard. Very, very wild. I'm sure you've heard many of these. First, the pandemic was a hoax. There were also claims that it was planning to trigger a rise of a new world order. And there were claims about miracle cures, many preventative therapies, many of them highly dangerous, some of them even promoted by certain world leaders or leaders. And very quickly we saw lives being lost as a result. Thinking that the virus was a hoax, victims of this information were ignoring public health guidelines. They refused to distance, they refused to mask up, and they refused to seek treatment when they got sick, and many, too many, they too died. And once the vaccines arrived, of course, the narrative shifted. The vaccines were a plot to depopulate the planet. The vaccines made you sterile. The vaccines were more dangerous than getting COVID. And more recently, when monkeypox arrived, we then saw claims that monkeypox was caused by the COVID vaccine. So in crazy, we can laugh about it, but unfortunately, millions of people around the world actually believe this. By the way, conspiracy theorists are also saying that monkeypox was invented as a bioweapon in a lab in Ukraine. So wild as these things are, research shows that most of these lies stem from a relatively small number of actors. one analysis by the Center for Countering Digital Hate found that just 12 actors, who they call the Disinformation Dozen, were responsible for up to 2/3 of the anti-vaccine content on Twitter and Facebook. And who are they? They are snake oil salesmen, if you ask me. Many of them are entrepreneurs for fake cures and supplements, and quack doctors, alternative medicine practitioners. Many of them are publishers. They have books peddling fake cures. They have courses. They have DVDs. They have films, and many of them are based right here in the U.S. It's a much bigger problem, and it goes well beyond COVID-19. And I have to say, as I was preparing for this talk, I recalled, and I was just thinking about the Disinformation Dozen and the actors there. And I remembered back in 2016, when I was also very close to here, and I had just come out of Dana-Farber Cancer Hospital, having been diagnosed with stage 3 breast cancer. And the oncologist told me that I would have to go through 8 cycles of very brutal chemotherapy, surgery, at least 25 rounds of radiotherapy, and then many, many, many years of hormone therapy. Listed all the side effects nobody wants to hear. And I was at the kind of pinnacle of my career on the transition team for Secretary General. And I was in shock. And what was my instinct? To go online. I really have to go on chemo. Isn't there another way? But so I started looking through Facebook, and the first thing that came up was a website called The Truth About Cancer. And they were claiming that chemotherapy doesn't work. It doesn't cure the disease. And that I should go on kind of detoxification diet, and that there were supplements that they could sell to me that would work. Now, luckily, I went to the College of Communications at Boston University and had journalistic background, and quickly that part of my me clicked in, and I started looking at who was behind the site. The guy named Tyler Bollinger and his wife Charlene. And he's a bodybuilder, no medical background. I can't remember the numbers of followers, but it was one of those that made it seem like it was legitimate. And it was because how could so many people follow this website if it was flat? But anyway, the reason I'm telling you this is that it just occurred to me that he is one of the Disinformation Dozen. So he switched now to COVID conspiracies. And he was one of the biggest super spreaders of COVID-19. This was the guy who coached a young cancer patient who made national news, maybe even international news. Her name was Cassandra Callender. I think that was in 2014. I think she was around 16 when she was diagnosed with non-Hodgkin's lymphoma, and coached her how to delay her cancer treatment so she wouldn't have to get it, and work around the legal system until she was 18, and then arrange for alternative treatment for her. When finally it was so clear that the alternative treatment wasn't working and she saw chemotherapy, was too late and she died. And yet he is still risking people's lives on social media. A 2020 study by NewsGuard ranked the Bollinger's Facebook page as one of the largest super spreaders of COVID-19 misinformation. And the study found that the page repeated such false claims as the pandemic was planned, that the virus was built in a laboratory, and that COVID-19 is transmitted by 5G wireless technology. It's also cross-linked to other super spreaders like Robert F. Kennedy Jr., who I know you've all heard of, and who was very detrimental to turning people against other child vaccines, as well as Joseph Markula, whom I'm sure you've also heard about. And they cross-promote each other and make millions in their supplements and false cures. And So I checked Facebook again this morning and it's still going strong there. So something is wrong with this picture, right? It's not just damaging social media users searching for medical answers in the US vary. But the global power of social media means that conspiracy theories dreamed up in Tennessee, which is where these from, are seen by people in all corners of the world. And at the height of the COVID-19 pandemic, we saw these very same narratives that I just listed off to you, taking root in places in Africa, in Latin America, in parts of Asia, kind of local conspiracy theorists there found their own versions, and this was also at a time when, unfortunately, there was no vaccine equity, and the vaccines were being, first comes first, the rich countries, and then later the poor. So when the shots finally did arrive, the damage had been done, and many refused to get vaccinated or take basic precautions because they believed the conspiracies they saw on social media, and many died. We're also seeing this have a ripple effect in other uptake of other childhood vaccines that actually in many of these countries were really, really high. Countries that never had a problem with vaccine hesitancy before. One example that really struck me, I read a story about a Namibian football coach. His name is Marley Nagusimo, who lost 15 members of his family to COVID-19 in the summer 2021, just within a few weeks. And he had just gotten vaccinated, but he said all of his family members hesitated because of the conspiracy theories they saw. The social media in Namibia was awash with mis and disinformation around the vaccines then. So he lost his father, 4 brothers, sister-in-law, father-in-law, aunt, several uncles, and the family was buried 3 loved ones on one day. After they all died, finally his family members started to get the shots, but for many it was too late. I don't know, does anyone in this room have a relative that, or a friend, or a story, and just raise your hand if there's somebody who's touched you or refused to get the vaccine. Okay, I think it is, yeah. So I'm sure you share the sorrow and the exasperation. It's really frustrating, obviously, for us, but we realized at the UN that we needed to do something about this, and we really tried, and we created a response. It's called Verified. We worked together with an agency called Purpose. It's a social a social activism agency, and our goal with Verified was to kind of flood the internet with public health guidance around COVID-19 that was cool. It was designed to travel well on social media, to be adapted in different contexts, to work in various languages. We worked with 200 media partners from around the world at our country offices everywhere, creating also memes and music videos. And in the end, we published in about 60 languages. And it really, focused on staying safe. But we also kind of, in a way, we were fighting back in the same way that many of the disinformation actors communicate. They use human beings a lot, they tell stories. And so we were doing the same. We recruited just ordinary members of the public and said, do you want to be an information volunteer for the United Nations? Join forces with us and we will give you content. We'd really appreciate it if you would share it. Some people, even if you have a community of 20, it helps. So that was one lesson that we learned. And we also learned, how important it is to get ahead of the narrative. There have been a lot of studies since then that really point to the effectiveness of debunking. So I think we all knew, those of us, those who worked in public health, that we were going to face huge resistance around the COVID-19 vaccine, given the speed, given the name, Operation Warped warp speed, yeah. But I don't think any of us imagined how zany and crazy it would become. But we did learn the importance of being very proactive, because obviously in any crisis, rumors are going to spread like wildfire, but here if they're intentionally spread with the help of these algorithms, it's going to be much worse. So definitely much better to get ahead than trying to debunk or after the fact saying false. In fact, there are a lot of studies that say doing that doesn't work either, because you're continuing to spread. You have to put an alternative narrative out there. You have to get into that space. There were a lot of data voids, so places where people were searching and finding nothing. So we really tried to get, enter into those voids with our content. And yeah, we needed also to scale. And the way to scale was to also use influencers. The way to scale was also using people who were not institutional, who had influence in their communities, but were not really associated with big organizations that they had no relationship to with headquarters in New York City. But a local scientist, a local doctor, we gave them training and tools on social media platforms and TikTok, and that training turned them into kind of social media stars as scientists, bringing people into their labs, answering their questions, and then they were subsequently invited on national televisions. So we took a step away in this experiment as the United Nations and let them do the talking. There were so many people out there who wanted to help. And there were so many scientists and doctors and public health officials who were trying to do the right thing to communicate. So we did a little bit of our part to help them. So yeah, people are just receptive to hearing from voices that they know. Obviously, we continue to use our celebrity influencers. They also help, but interestingly, in the pandemic, those who were trusted most were doctors and local influencers, and not necessarily the big those with the hugest followings. So we got tons of I'd say the experiment worked. Did it solve the problem? No. Did we make a dent? Yes. Maybe we turned some minds, we changed some people. In fact, one of we did one study with MIT that showed that that our videos increased vaccine confidence by up to 12%. And so that was that problem. Finally, we realized that, there are many ways to address mis and disinformation. One is the proactive kind of content and the influencers that I just mentioned, but also we have a problem with users. We all, for one reason or another, are on social media. Many of us like being on it, others feel that if they're not on it, then we're missing out. So, but many people we have found are not versed in how to navigate social media properly. So we believe, media literacy is something that governments need to put into every curriculum in every school. But in the meantime, we made our attempt through a campaign that we call Pause, which urged people to take care before you share, and really put out some of the tips for how to scrutinize the information that you're seeing. If your heart starts palpitating, maybe you might want to slow down and take a look at it and see if it really is true. Twitter, interestingly, very shortly after we launched our campaign, came up with a similar tool. I think, have any of you tried to share an article that you haven't read on Twitter? Some are nodding, confess, and then the box comes up and it says, you really want to share that, you haven't read it. It's quite embarrassing. So I think it's very effective. I know that they have studied, and we think, the kind of impulsive sharing and is, it's only if an article, they can share things impulsively, if there's no attachment or no link. But still, it does instill something into the brain. Much more needs to be done in this field, but that was one of our triggers. And then, we finally, have to confront the platforms, and that is something that we do on a day-to-day basis. But the problem is, our response verified was born out of the pandemic, but mis and disinformation exists on a much wider scale. And we believe that from what we're seeing from the perspective of the UN, and I mentioned the big C's, that our peace and even the future of our planet is at stake. And I just want to shift to the climate emergency, where we're seeing false and misleading content, warping public understanding, and undermining climate science. It's also delaying urgent action. The latest United Nations IPCC report stated this unequivocally. It said, and I quote, "Deliberate undermining of science financed by vested interests for delaying climate action and preparedness." It blamed deliberate undermining of science financed by vested interests. Vested interests, you can imagine the vested interests are. It's first and foremost the fossil fuel companies. No longer putting out their climate denial, but saying that that it's not really as bad as you think, and that it doesn't need to be now, and also kind of confusing the public, which is the strategy. So, downplaying the danger and adopting strategies of the big tobacco playbook, deploying micro influencers themselves to push their messages across social media. And, obviously our window on climate is closing, and we certainly cannot afford to let this go unchecked. We also are seeing real immediate harm in the theater of conflict. We have seen again and again how dehumanizing language spread on social media can incite violence. Our most compelling, and I think it's the most cited example as well, because it's the most researched, is around Myanmar. We found in 2018 that disinformation and hate spread online played a significant role in stoking the unspeakable atrocities that were committed against the Rohingya population, basically giving license to kill, license to rape, and license to drive out 700,000 people from Myanmar into Bangladesh. And more recently, we've seen disinformation spread in former flashpoints in the Balkans. For example, I was just in Bosnia and Herzegovina, where the genocide of Srebrenica is being denied. It's being, we see a lot of Holocaust denial, by the way, as well as war criminals glorified. Obviously, I could do an entire talk on the information war in the war narratives around the war in Ukraine. Most of this is state actors going against each other. The amount of fiction is it's incredible, but it's also very, very disturbing. We're also seeing this in our peacekeeping operations, where in a recent survey, 44% of disinformation was having a critical impact on them being able to carry out their work. And a similar number said that it was severely impacting their own safety. Now you imagine the blue helmets, you have peacekeepers, they're there to keep the peace, and yet it is language that it now is traveling on these very powerful networks that is really making their job more difficult. So it really is what's led us here today, which we think is a day of reckoning, and that our collective response, and that's why I'm so glad to be here with so many parts of Boston University that are seized with this phenomenon. Our response to mis and disinformation must become more robust, and we need, if we're going to build a better world, which I know is all what we all want to do here, we need to rebuild trust in facts and in life-saving public health guidance. Countless lives and the whole, stability of our world is on the line. We really believe that much of this response needs to focus on the social media platforms. They're not all bad. I'd like to say that. I mean, far from it. They do, I think, have connected many people in really important ways. They give voice to people who didn't have voices before, marginalized communities, and they offer community to many. We think about the Black Lives Matter movement, we think about the Me Too movement, we think about countries where information is censored, journalism is censored, we're seeing many voices able to get out because of social media. So the challenge is, how do we harness these good parts? And because the harms are outweighing the benefits in our view. Elon Musk likes to refer to social media as a global town square. But I'd like to ask, is this a town square that we really want to be in? Because it isn't really a nice place. In fact, it is pretty dystopian. The only problem is I think we all feel compelled to be there because we don't want to miss out, right? It's where it's all happening. You can join conversations, discover new trends, find what's going on, connect to people. But the town square isn't what it seems, because people, when they enter it, they might think that the entry is free, but it isn't, because our data is being constantly collected and constantly monetized. We also might think it gives us a megaphone to speak to the world, but the noise is kind of deafening. When everyone is shouting, those with good intentions and those with bad, and unfortunately, the bad tend to get the biggest megaphone, because the way the sound system is rigged, it is against other workers in favor of the bad. We're profiting from fear and confusing the obscuring the facts. The thing is that the platforms make this easy for them. They actively reward bad behavior. As I mentioned, they monetize the data, and that data is generated by engagement. And engagement is prompted by outrage. And outrage is easy to manufacture if you don't feel that you have to stick to the facts. So the algorithms are hardwired to amplify provocative material, and I would say hardwired to spread lies. Yet the platforms largely don't seem concerned about this. It seems that they're primarily interested in getting more data about us, about every single one of you in this room, so that we can be targeted by advertisers and they can make more money. So the result, our polluted information environment, so we're not sitting idly by. We're struggling to cut through the news, but we're struggling to get better at our own communications methods. But one thing that we have the cards kind of stacked against us, and most people wouldn't know this, but you would think that the United Nations would have a special place on social media platforms, and these platforms do communicate. We communicate with us, as I mentioned. We even partner with them. They want to be associated with the United Nations. They want good information to get out there, but they're not willing to change their business models. But also there was on Meta, Facebook, there was a change in the algorithm years ago, which favored family and friends over institutions and pages by organizations and also news organizations. And the result of that is what they call that civic institutions that are under that category are downranked. that means that the United Nations starting point is here, whereas Joe conspiracy theorists starts up here. And so then they give us ad dollars to be able to, jump up again. But it's this constant struggle. And it's, we talk to them about it and they acknowledge, but it still haven't solved the problem. It really, we don't really know how widespread also the phenomenon is and who are all the other institutions who are downranked because they don't tell us. Those of you who study recent disinformation know that transparency is one of the biggest problems in getting data out. So anyway, Frances Haugen, Facebook's whistleblower, blamed this tweak in their algorithm for our current problems because it helped bury reliable sources and bury and amplify false and misleading content. So yeah. Anyway, so I'm just gonna what exactly are the solutions and what can we do to protect our societies against deliberate harm? There's a lot of debate and everyone I talk to, it's just really complicated. But there's also a question in the whole debate about free speech, where of course, we all believe in freedom of speech, but not any speech. Certainly not illegal speech, but there is a category of speech that is causing real harm. Yet, in the view of many of the platforms, it really is, kind of any speech, and it is out there. They should not be editors or arbiters of truth. We have political forces also in this country who very strongly believe that. So this is a debate that makes things complicated, and yeah. So the other thing is that even when the platforms want to help, it's kind of like Frankenstein's monster. Many times they find that they're not even fully in control of what they created. The Washington Post recently found that on Twitter, doctors, scientists, and advocates attempting to warn the public about the dangers of the virus have their tweets systematically flagged and their accounts suspended. So Facebook's COVID policy, Mark Zuckerberg told WHO he wanted to help, and he said he was going to use his platform to spread life-saving health information. But the cat was just so far out of the bag at that point, and then the moderation that came in was just like a game of whack-a-mole. So as quickly as their moderators would find and remove harmful content, disinformation actors would find a workaround. One recent report found that right now, anti-vaccine groups are using carrot emojis to hide from moderation tools. So basically, they put a carrot symbol instead of the word vaccine. And then the content is the same, but this evades the detection of the algorithms. We're also finding that the pro-vaccine content, because it contains the word vaccine, can get taken down. I also had this problem when I was working on behalf of refugees, because that's another long story. But so there are blind spots, and yeah, also comments written below UNICEF and WHO posts. There seems to be zero control by Facebook over the comments that are written there. Some of them are just really harmful and misleading. So we have a lot to do collectively, and there's no silver bullet, but we are looking for solutions. My team and I are working on a code of conduct on integrity of public information. We're looking forward to also benefiting from a lot of the research that's being done here at Boston University. We do want to put new guidelines in place and use the power of the United Nations to advocate for a more humane internet. And yeah, we're going to be consulting and ultimately holding the industry accountable for how well it responds to the dangerous side effects of these business models. So I think I am going to end it there, just to say that, if we are going to succeed, we can't do this alone. there will be more pandemics, and before the next one hits, we have to be smarter, more strategic with our communications. And not say we haven't been warned, now that we know that the lies aren't going anywhere. So whatever new health threats emerge, we know the conspiracy theorists will follow. And there's a lot we can do to get ready for the next time. So let's, if the years have taught us anything, if we do stand up to the lies, we can save lives. Thanks for listening.
Thank you so much. For very informative talk and sharing the personal story about this disinformation. So I want to be mindful of time. Just a couple of questions I think that a lot of students and faculty want to ask you. And then after that, we will open up the floor to questions from the audience, both the audience here, physically at BU, as well as our Zoom audience. So folks in Zoom, feel free to drop your questions anytime into the chat. Some people can't tell, but this room is packed. It's expanding the room. Welcome back. It's great to be here. I think one of the main takeaway points that I got from your presentation, but the ability to get in front of misinformation, debunking, correction, is what we were. And you spoke a bit about some of the partnerships you have with tech companies. Is that the solution? Is that the solution going forward? Is government tech partnerships to combat misinformation?
I think there's a whole menu of solutions, and one of them is definitely to communicate with the tech companies to ask them to make changes, reduce harm, and also to elevate content that is serving the public good. So yeah, definitely it will come in the end come down to that. Governments can also, and you're seeing it, the European Union has now just instituted the EU Disinformation Act, which we expect is going to really be a game changer for how the platforms operate in the context, and maybe be a model for the rest of the world, maybe, but we'll see how it works. So government regulation, but also platform self-regulation, and then those of us who are communicating for good, whether it's journalists, whether it's public health officials, whether it's professors, university researchers, we have to get better at communicating. The stakes are higher, and it's much harder, and there's much more competition. So we need to learn the best arts of storytelling and how to also work the algorithms, and to recruit all of those forces for good out there for to make the world better.
There's one thing to uprank the website, right? So it's Google and UN have partnered in upranking the website. Someone searches for climate change, for example. But it's another thing when content, user-generated content is moving. And currently, I think a lot of the platforms use a hybrid human AI approach where human fact checkers work in conjunction with automated systems. Toxic comment, misinformation, disinformation, hate speech. But they made it very clear in Meta that they were going to move more towards a purely AI approach. But what's the UN's position on that? Moving the human elements to fact checking and understanding where misinformation is.
It's hard for us to predict how human AI can become. It's kind of scary, actually, but right now it's not human enough to detect. We're seeing AI, misinformation and hate all through the AI all over the world. So while I'm sure it is working to identify a lot of that content and take it down, it's not enough. And we're seeing a huge problem in many fragile countries and environments where there are very few if any at all, human moderators. And when our country team colleagues are, calling us and probably calling Charlotte, this kind of our social media team here, and said, "Oh my God, look at this post! This is incitement to violence. This is going to make the war worse. Please, can you do something about it?" And she'll call Facebook or Twitter or wherever it was on. And if we're lucky, they'll take it down right away, or they might study it for a few days and then see if it beats whatever it's too slow and it's not enough. And it's not enough to I think it was Francis Howling, whistleblower, that I think it was something like 80% of moderation is in the United States and the rest of the 20% to the rest of the world. But even if you had all, we still have a problem in the United States with all that moderation. So obviously the AI and moderation is not enough to stop this disinformation and hate speech. One has to maybe look at the ways it's designed.
So I want to open up the floor to questions from our students. One question I think students will likely ask, do a lot of work about social good and the life conditions of people in life. We have students here from all 50 countries, from over 100, over 50 states, over 100 countries. And 19% of our students are first generation college students. They are ready to make their mark in the world. Share with us how you found this home of your life story and how prepared you for a year in a global citizen.
Well, I thought the journalism is such a noble profession. It really is. It's a pillar of democracy, and it is. It felt so purposeful when I was going out there, and I did switch to working on the other side, but the other side was not, for ExxonMobil. It was more, for good causes and for institutions that were working for peace and a better world. And that really feels good. It is, you're going to spend so much time at work. I mean, it's like, unless you're all of it, because you're pursuing academic, the likelihood that you're going to have a very 9 to 5 job where you can just put it all aside and then have the rest of your life, all of your weekends. People spend a lot of time at work, and it just feels so much better if you're spending those days and time doing something that is doing good for the world and is also giving you a sense of purpose and a sense of gratification.
And with that, let's open up the questions to many hands up. You can just say your name when you ask your question. I'm going to gentleman up here.
Ari Trachtenberg. How do you define misinformation, especially in fast emerging fields like happened at the start of COVID?
In fast emerging fields
When COVID, when we first came on the scene, and there was a lot of doubt and uncertainty and not.
No, I think that's an important question. There really is a distinction between misinformation and disinformation. Disinformation is deliberate, and it is created for intentional things that are not for the public good. So, to sow confusion, disrupt, cause harm, make people pray, deflect, shame, hurt. So it is really, it's deliberate. Misinformation is the sharing of bad information, but very often not even knowing that. It was interesting. We were just before this, we were at the Shorenstein Center at Harvard, and they have a program that is working with journalists because of a study that they cited from Columbia University, another university, that found that journalists were actually purveyors of misinformation in a big way, but unknowingly. And so they're working on that as well. So I think it's just the spreading of bad information, misinformation, unconsciously or just because many people who share often say, oh, I know it wasn't really real, but it just looked kind of interesting. But the worst is the disinformation, and that's what we need to address.
Right, and there's a hand right back there.
Hi, I'm Chloe. Excuse me, pardon me, 2010. And so I'm director of student affairs at the law school, and I was curious for this talk to just because we have a disinformation issue on our campus, and I was like, let's hear it from a different context. And so the more that you've been speaking, and thank you so much to you and your team for your work, but just thinking of, I've seen a lack of critical thinking with my students, which has been a huge challenge of like the question on misinformation and what is that? Is there been a thought for the UN and working to really educate people across the world of just thinking more and reading of what they're absorbing, and also then how you and your team handle like those challenging days where you're kind of feeling like the world's not like
No, that's interesting that you have that observation. You know, and obviously students here have been brought up on social media channels and access information so much differently than when I was growing up. Watching the three networks and the evening news all at 6 o'clock, and all, you know, pretty much reporting the same thing, just competing with each other in different ways, and all of America watching the same thing. So, and now, yeah, so guys, like I would just be hearing my son speaking, and there's, how do you know that? And he's like Vice, or and at least it was the 45-minute documentary, but mostly, you know, subreddits. And so it is I think it's also up to us to understand how our young people are receiving information, but at the same time, we need mass education in how this information they are receiving is actually affecting them. Because there was also, I can't remember the exact source, but that even if you read a credible news story but from a social media platform, your level of trust in it is going to be much lower than if you clicked on the New York Times app and we're reading it from the newspaper, you know, and really like, okay, I'm on the New York Times and stuff. So there already is this awareness that actually I'm here, I'm getting the news, I'm getting the information. I don't really believe most of it anyway. And in a kind of acceptance of, you know, I don't know what to trust, and this is the environment we live in, and as we can do so much better. There is such great information out there, and it's amazing. And so, yeah, we don't have any resources or plans. We're definitely parts of the UN, like UNESCO, work on media literacy, but I do think it is up to governments and curricula to. And your second question was how
you cope when you run into these challenges.
Oh my God,
I can't even imagine.
I don't know, Charlotte, do you want to answer?
I mean, you just have to keep going, right? And you know, it's very, very hard and very overwhelming sometimes. I mean, the UN corporate accounts, flagship accounts that my team runs, we have about 60 million followers, which is significant. But sometimes you do feel a little bit like you're screaming into the void, to be honest, and you know, it can be overwhelming. But having said all that, we do also see the community engaging, we do see people sharing, we do look at that feedback. It is a two-way conversation, and you do see results. So there are people really desperate for credible information, for factual information. And that's why it's so important to have a presence on these platforms and to, you know, keep on going. The Secretary General always says, you know, we must never ever give up. You know, no matter how bad it seems, never ever give up. And I always think about that, actually. He's right.
He does, yeah.
Thank you.
Thank you, Chloe. I want to take some questions from Zoom, audience. Erica, please. Yeah.
I'm Erica from CEID, and looking at the chat, we have a question from Pearl. And Pearl says, from your experience, what is the most dangerous channel or method of spreading disinformation? Is it family and friends? Is it the news, or is it fake news?
All of the above. Because some family and friends have actually been. And because it depends on the context, but it's like in a pandemic. And it's like, who do you trust? I think that we've seen there are many sites who actually collect the stories of people who are unvaccinated dying. And they kind of look at the context, that very often it's because their community of friends were telling them, don't trust the vaccine. Not their public health officials and not their, so I think it is, and I know I talked to UNICEF also before this talk, I said, how are you addressing this issue of not just, we have to get people, continue to get people around the world vaccinated with COVID-19, but also childhood vaccines. And that with all of this hesitance, and emphasize, so really just know the context, know what it's by, really figure out what the rumor is. So it really, it does depend on the context, but then again, there are these super spreaders who once identified, it would be easy to, when you think about, I mean, those big 12 disinformation actors, they were no longer there. That's supposedly, and we don't know exactly, but is the majority of this disinformation conspiracy on Facebook. So, identifying who those those actors are and their enablers, and really kind of put a stop to either flagging their content or taking it down. So, I mean, we didn't talk about governments too, but that's a whole nother realm, and also very dangerous, but on what they're trying to do and the harm they're trying to cause and the tools they have.
It's a really good point. So we focus a lot on media and social media, but also the in-person communication. Will be disinformation. With that note, we are just about out of time, and on behalf of CEID and our co-sponsors and all the students here, thank you so much, Undersecretary General, for a delightful, insightful conversation on public communication in the era of disinformation. Thank you all for coming.